Well, good evening, everybody. This is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, and we deal with a lot of patients that have fatigue. When you say fatigue, I mean debilitating fatigue. So it's so bad that it actually creates lots of problems in their lives. And so we're going to talk about fatigue here today. Yes, we're going to talk about chronic fatigue syndrome on our next live stream specifically. We're going to talk a little bit about it today as well. But let's see if our live is working here, right? We're trying to create a new stream. Well, let's see what that works. Checking out here. Making sure this is working here on our end. It looks like we're still live. Okay. All right. So I'm back here again. We are trying to focus here on fatigue here. And so we have a lot of good information to talk about with regards to fatigue. And so many patients, they come in, they're tired, wore out. They say they're feeling like they're losing their mind. Something's not quite right. And they're just so incredibly tired and so wore out that they one of their messages is, I just can't handle it anymore. I just can't do it anymore. That being the case with fatigue, there's almost always a cause. And yes, you can have somebody that just has too much workload on their body. There's almost always a cause. So getting to the root cause is important, especially for those who just out of the blue, these things are just starting to get worse. And there's lots of patients that over the last 4 or 5 years that this debilitating fatigue has just been overwhelming for them. So we do a lot in our office here, just a lot of functional medicine services, do a lot of lab work, do a lot of nutrition services, and I do a lot of continuing education teaching for lots of different folks across the country. So I do some continuing education training for MDs and DOs, nurse practitioners, PAs, chiropractors on the topic of examination, but also in the area of nutrition and also other functional medicine services that kind of get to the, like I said, root causes of problems. So what we're going to go through here today is a little bit about some of the hidden causes of fatigue that you should be exploring. And if you haven't explored these things, most likely you're going to find that some aspect of your fatigue, even if you've been told you have chronic fatigue syndrome, which is a horrible diagnosis because it's a diagnosis based off of exclusion. They have ruled out a lot of dangerous kind of things, which is good usually if you're going to get that type of diagnosis, but it's kind of a junk type diagnosis. They've ruled out a lot of other things and come down with chronic fatigue syndrome. Now, that doesn't mean that it doesn't really kind of exist, but remember that fatigue and the aspects that control that in your body, it's multifactorial. It's usually not just one thing. It affects a lot of people throughout the entire country. As you can see, the stats here, around 13.5% of adults aged 18 and older report feeling that they're tired and exhausted every single day. You're talking around 25 million adults here in the United States have some level of extreme fatigue daily. That is a lot of adults. If you look at chronic fatigue syndrome, or the new name for that, not chronic fatigue syndrome, but if you look at the new name for that, myalgic encephalomyelitis, that's the new name. There's your mouthful for the day. But there's around 1 to 2 million people that have been diagnosed with that. But if you talk about, like I said, just fatigue in general, those that have kind of chronic fatigue every single day, you're talking around 25 million. A lot of Americans, in excess of 13% of adults have fatigue. So it's an important one. And I tell you what, probably almost every patient, when they come in, if they got joint pain, or let's just say they have tummy problems, or if they've got maybe some type of autoimmune condition, almost all of them are saying also that they have fatigue. So trying to get to the root cause of fatigue is an important thing for sure. So we're going to go through a variety of the top causes of fatigue here in our presentation here today. But if you look at to next time, because this is going to be a two-part series here, next time we're going to go over the last three hormone and also post-viral consequences causing fatigue, and also chronic fatigue syndrome. We'll go over those next time, because we just have a lot of information to go through. So let's look at this one. We just look at the first one there, the first kind of thing that you should address. If you have fatigue, you really should. And these are kind of these are kind of the no-brainers, the things that the studies show conclusively that these things, when we're talking about chronic stimulant usage, poor diet, also drugs and medications, many of these most certainly can cause fatigue. And if you're not dealing with these things in particular, and you're just saying, well, I'm just tired all the time, and you're thinking, well, this is because of a virus or because of a toxic substance, something that's hidden and you won't be able to find it. Sometimes it's the easy stuff. So if you look at the ultra processed foods here and look at the research on that they most certainly can have an impact on cognitive function, on anywhere from type 2 diabetes, of course, and yes, also on fatigue. Your chips, crackers, soda, all these things. You can't just blow this kind of research off. If you have chronic fatigue, whether it's chronic fatigue syndrome or you're just wiped out all the time, you've got to address the ultra processed foods, because those things have to be having an impact on you. The medication kind of aspect is kind of a no-brainer too. If you talk about like alcohol and also taking stimulants all the time, if you're a chronic smoker, even tobacco products and alcohol, those most certainly are going to affect your neurocognitive function. And most certainly, if you're drinking alcohol on a regular basis, you will be tired and wiped out the next day. So always remember that. Had a patient here recently who just came in, and they're trying to figure out why they have all this fatigue and energy drain throughout the day, and it seems like they can't even do their job anymore. And so you start asking the questions, and they say, well, I kind of like Jack and Coke, and I drink that all the time. And so you're like, well, yeah, I'm sorry, you can't take a supplement to get rid of Jack and Coke. You just can't do that. You have to get to root causes of the problem. And if alcohol is the issue, or we'll show you, I think, another case example here in just a moment. We're talking about sleep, because that will mess with your sleep. And sleep is important. Doing your stimulants or doing your depressants like this, alcohol, and doing that before you go to bed, that is going to mess up your sleep. And that's important for fatigue 100%. Did you know that there are other medications, such as your antidepressants and also your cholesterol medications, your allergy medications, high blood pressure medications? All of those have the possibility of causing fatigue. So 100%, if you're taking an antidepressant, you have some anxiety, depression, and you're taking some type of anticholinergic medication, Prozac or one of those, there's studies showing it can affect you cognitively, slow down cognitive function, and also affect your level of fatigue. Same with your cholesterol medication, your blood pressure medication. In particular, some of your blood pressure medications are meant to calm down your heart. And if it calms down your heart, it might be calming down you and cause you to be a little bit more calmed down or more fatigued. Cholesterol medication as well, allergy medication, many of those can contribute to causing fatigue. So it's important for us to not just look at all our lifestyle and thinking about some of the more obscure things. So do I have a thyroid problem, or do I have some type of toxic metal or something I'm being exposed to, or mycotoxin? Is it possible that the medications that you have every day in your cupboard, or perhaps you've been taking them for a long time, that now they are potentially causing some problems? So it's good to make sure that we're addressing all those and not just blowing off the medications, because they can certainly cause that. And back to the foods here, this is a good point. You need to be getting away from the processed foods and getting away from as many of the medications as you can. I'm not telling you to stop taking medications, but I am saying that we should understand that sometimes the medications that we're taking and the foods that we're taking in that aren't even food, that they may certainly have an impact on our health, an impact on our sleep, an impact on our level of fatigue. When we've got around 14% of adult Americans who have chronic fatigue, like all the time, that doesn't happen by accident. And it could very well be because you're eating a Dorito, because you're drinking soda, because you're eating lots of crackers or chips, or eating ice cream every night, or any number of things, or you're taking one of the medications I just talked about. So it's important to address all those and make sure that we're looking at your body and having this basic concept that you should be putting in your body that is made by God. Your body made by God should try to be putting foods in it and things in it that are made by God and not made by man and eaten in their most natural state. If you want to have less fatigue, then you should be trying to put the things that are made for your body to put in there. Sometimes you got to do medication. I get that. There's crisis management that's necessary at times, but we should be trying to give our body what it needs. And you can test and you can figure that out. Whether you're deficient in something, whether you have a toxicity issue, you can test and you can see if you need to cut out some food or something like that too. And that's exactly what this individual did. So you see this individual, and he came in and he had a lot of joint pain. So he had a lot of joint pain, osteoarthritis. He did not have rheumatoid arthritis, but he came in and his two symptoms. One was joint pain and the other one was what? Fatigue. I told you, that's like every time somebody comes in, they have one problem, almost always the second one's fatigue. So he came in with joint pain. And we can see on the top of that blood test, you'll see the LDH, which is a soft tissue inflammatory marker. He has some inflammation that's going on there. You can also see down in kind of the lower third, his vitamin D is clinically low, significantly low. He has several other things going on there as well. In fact, his thyroid is just a little bit off too. So what did we do with this individual? Well, we changed his diet, had him cut out all the crummy foods, the ultra processed foods. In his case also, we did have him remove and eliminate all gluten out of his diet. That's like the main thing. That and corn, I believe, are the two in his case we had him eliminate based off what we did with a test where his body was saying he shouldn't be consuming it. Now, this is an interesting point. Now, he came back. Yes, he came back about 3 months later. And he looked different. I mean, he had a glow in his face. He had more energy. You could see just without even talking to him. He had a little bit of a smile on his face. He also looked like he had probably lost around 5 to 10 pounds. I think it's around 10 pounds. And it was over about 3 month period. And in talking with him, of course, his joint pain, by the way, was almost gone. You know, he was taking ibuprofen multiple times a day and tried to get to sleep at night because shoulder and elbow and lots of things going on there, lots of pain. But guess what he also said? He said, I cannot believe how much more energy I have. If you have inflammation, and the reason why you have inflammation is because this pro-inflammatory status is in your body is spending time and resources with a lot of inflammation in a joint, trying to heal a joint, but maybe also you have an autoimmune condition. But either way, with that level of inflammation that's in your body, that is a work. It's a work on your body. So if you can bring down the inflammatory status, it just gives your body more resources to do other things. So in this case with this individual, where their inflammation improved, their fatigue disappeared almost completely. They said they felt like almost like a 50-year-old person instead of feeling like an 80-year-old person. So their energy skyrocketed, their inflammation went down, they weren't needing their pain meds anymore. Awesome things by addressing the dietary component. Very important thing. Of course, vitamin D levels improved and omega-3s and all those kinds of tests. Exercise is important. You know, when you think of fatigue, you don't think of actually helping out a level of fatigue by doing exercise. But by doing exercise, that has an impact on your thyroid. Yes, exercise helps your thyroid. Exercise helps also your hormone levels. If you look at the studies on right here on exercise and its effect on estrogen levels, and we know estrogen can affect breast cancer in at least on some of those that are estrogen dependent. But still, in general, we know that exercise has an impact on sex hormones. We know that exercise also has an impact on the thyroid and thyroid hormone conversion. So it is important for us to consider that if you have fatigue, and I know that when you're feeling crummy and you're tired and wore out, it's very difficult to kind of bring yourself to a point where you're like, yeah, I think I want to go exercise. I'm all tired here, but I think I want to go exercise. But, and same thing, you may have joint pain and things, and you feel like, well, I don't think I can go exercise. But you have to start somewhere. The body is designed to move. The joints in your muscles are designed to move. And if they're not moving, that definitely is a detriment to their function. When you move, you detoxify. When you move, you bring circulation, you bring oxygen to the brain. When you move, you help actually with tissue repair. It's an important thing to do, to exercise. And if you say, you know what, I'm wheelchair bound, I can't go anywhere, I can only do stuff from a chair, and I just can't exercise anymore. First, I totally get it. I relate to you. Most people, they like to do the exercise they like to do, and they don't want to do other things that they don't want to do or they haven't done. So it's sometimes about trying new things, but even from a chair, you can do certain things like seated marches, where you're just sitting upright in a chair and just bringing your knees way up high and way down low and just back and forth and back and forth. You can do also kind of a modification of that, which is actually side steps, where you're bringing your left hip over to the side, and your right over to the side, bring back to middle, and then you can extend your feet back and forth. And doing that repetitively, you will have cardiovascular exercise. You will be moving lymphatic tissue fluid throughout your extremities. It will help with circulation. If you do that, it's going to actually improve circulation. Even seated jabs, even for your upper extremities, you can do different seated jabs from sitting in a chair, or chair boxing. There's whole videos. You can look up chair boxing. Look it up online. There's tons of chair boxing and seated exercises that you can do. Not just do them and you're just throwing out your fists out here, but actually when you're doing it in such a way that you're putting a little bit of work behind it, you definitely 100%. I guarantee you do that for about 5-10 minutes. You will start feeling your heart rate elevate, and it definitely is an exercise. So you can do that. Don't be discouraged and say, well, I can't do that. I can't do any exercise because I just have to sit in my chair all the time. Most certainly you can. It's just a matter of finding something that you're able to do. And even those chair exercises are super easy ones for you to do, and you can do it. That's the point from a fatigue standpoint. From a functional medicine standpoint, we need to stop taking this perspective and this approach that you have one pill that's going to fix you for all these problems. We know that fatigue is often multifactorial, and so is joint pain, and so is about every other condition. And if that's all you're doing is you're just taking a single dimension approach and not taking a multifaceted approach, you might very well be getting nothing accomplished. That's why conventional medicine is often very effective at treating infectious diseases and traumatic injuries, but it is often ill-equipped to handle complex, multifaceted conditions and illnesses. So it's important for us to take a multifaceted approach and not just treat a condition, but treat the body, treat the whole body. Because if you do treat the whole body, you also deal with any of the conditions, right? So if you deal with deficiencies and you deal with insulin levels and all those types of things, you often are going to improve a person's joint pain, which is exactly what we did with this individual. It happens all the time. So let's move on to poor sleep. So sleep is an important one. It is so important. You need to have adequate sleep. And we were talking about fatigue. Well, that just totally makes sense. But some people actually, that's what part of the chronic fatigue diagnosis, and not just chronic fatigue syndrome, but if you have somebody who truly has chronic fatigue, what it is, it's fatigue every day, and it doesn't even matter how much sleep they're getting. Sometimes it's the quality of sleep that you're getting. And so there are lots of individuals that will have fatigue and they're tired all the time, and it's actually something that's going on at night. They don't even realize it. So with this individual, they came in and their main symptom was fatigue and actually falling asleep all the time during the day. That was their main symptom. And now this person was overweight, and they also had high blood pressure issues. And so we did some lab work with this individual, and we found out that, yes, they were a type 2 diabetic. Their A1C was at a 7.4, which is a diabetic range. You can see their glucose is up there too. And you'll see just a little bit of some thyroid things going on and also some inflammation. There's that LDH, that marker that the other gentleman had. LDH was high. His vitamin D was low, testosterone was low, inflammatory marker, C-reactive protein. They have inflammation. But listen to this. If you do not sleep well at night, this is important. In order for you to heal joint pain, you need to sleep. In order for you to have your tummy working properly, you really do need to sleep, or to actually think properly and have proper memory control and all those kinds of things. You need to be able to have adequate sleep. So sleep is an important thing to make sure, but it's tough sometimes to know what is happening when you're sleeping, right? It's tough. So with this patient, what did we do? We did a sleep test. And on this sleep test, where we're looking at how many lack of breathing events, I'm not saying everybody here has sleep apnea, but it is important. If you have it, it's important. If you look at this individual's central apneas and obstructive apneas, 2 and 65 on the obstructive and 15 on the central, it comes up with this rating that shows basically they have an AHI of 54.6, which is severe sleep apnea. Now that's all those are confusing numbers that you really don't need to know much about. But look at under the bottom half of the test there, and you look under the average saturation, average oxygen saturation. Your average saturation during the day here, if I just take a little O2 meter right here, take an O2 meter, just put it on my finger, and I just crank that puppy up. And let's just see what mine comes up to, just here sitting here doing this, if it'll give me a reading quick enough. But average, or normal rather, is from 95 to 99. Now, if you can see this or not, but we are what? I don't know if it's backwards or not here. Oh, there we go. There we go. There we go. Maybe that's better. But anyways, I am at was 95. Now it's back up to 96. So at any rate, 95 to 99, there's 95 again. 95 to 99 is considered normal. And so on here, you can see either average or having at a 79. That's low. If you do not breathe at night, and you have, for a variety of reasons, maybe there's weight is an issue, maybe you're drinking alcohol, maybe your sleep centers of the brain or your breathing centers of the brain are not actually communicating properly with your lungs, that's going to affect, of course, your oxygen levels. So that's important. So this individual, this individual, we actually did put him on, get him a CPAP machine. And he also, because of the CPAP machine, it helped him to lose a considerable amount of weight. Some people can completely not even need to use their CPAP machine after a while. We have lots of patients who've done that. There's another individual looking at their sleep study, and you can see that this is 115. Over a 30 is considered clinically a significant or severe sleep apnea. And this is way high. This person, I wonder what their oxygen levels are. Oxygen around night, 81%. So all the way through the night, if your oxygen is low, your brain is starving. That will affect how you sleep the next day. So that's an important thing. So sleep is important, and you can actually test your oxygen levels throughout the night, even without doing any kind of a sleep study. You can do an oxygen ring, where an oxygen ring at night, throughout the night, you can see what your oxygen levels are doing. It's kind of Bluetooth to your phone. A good thing to note about sleep is that when your eyes are shut and it's dark, that's when your body is making melatonin. And so many people, before they go to bed, or actually when they sleep, they might have a TV on. They may have an iPad that is got multiple different videos and things like that going on too. But if you're sleeping with TVs and lights on, that's probably not a great thing. You should try to get some good sleep where there's no light coming into your eyes. It's, there's no ambient light like that. That's a good idea. That might also affect your melatonin levels, because that's what happens at night. Your body makes melatonin. And one of the reasons why is because there's an absence of light in the room. And that also helps with that sleep cycle. So it's important. One other point here on respiration, I talked about, sleep, of course, is important. And from that standpoint, I did want to talk about that real quick there. When you look at sleep, Lots of things, of course, you can do. You can check your O2 levels. You can also, like I said, get your O2 ring. There's lots of different supplements and things that might help with sleep. Magnesium, some people will take around a couple 100 milligrams of magnesium at night to kind of has kind of a relaxing effect. Some people will take GABA or even feverfew, some other herbals like that. 5-HTP. You can actually test and see what your melatonin levels, what your serotonin levels, what your kind of sleepy hormones are doing. You can test that through a urine test, and we do that quite often here as well. But some people really are. Their vitamin D is affecting their sleep, or their omega-3s are affecting their sleep. So getting to the root cause of why your sleep is off is an important thing. It may not have anything to do with sleep apnea. I totally get it. There's other reasons. But if you need oxygen at night, if you are deficient in oxygen at night, you can't supplement your way out of having low oxygen, right? That's important. So you need to get to those root causes. And if you're needing it, that's why a sleep test is often good for those who are having a tough time determining kind of what's going on at night. So if you're snoring at night, you wake up, you're just as tired as when you went to sleep, or you have daytime sleepiness, maybe that's a reason for doing a sleep test, but we can certainly facilitate and help that with folks. So this is kind of a part 2 on that, but those that have breathing or respiratory problems, in particular, those that have COPD or respiratory problems like that, and it could be related to smoking, of course, that most certainly is going to affect your oxygen levels. That can contribute to fatigue. If you have also cardiovascular concerns, you do have cardiovascular disease, or your heart is weak for a variety of reasons, most certainly you can contribute. That can be related to fatigue. And so here's an individual who came in and they had blood in their urine. We tested that, but then we also did a blood test and looked at 2 different things. We looked first at the red blood cell count. You can see here on the bottom test, this is their red blood cell count. You can see that their RBCs, their hemoglobin and hematocrit, they're all high. This individual has a respiratory condition, and so they have COPD. So they have COPD, and their body is having to take a lot of extra time trying to pass oxygen to the left and to the right and get that to these different tissues, because they're not getting in enough oxygen. They're not getting it in. In this case, there's a smoker, and we actually did another blood test, and you can see that their carbon monoxide levels were elevated because they're a smoker. But long term, what this has caused in their body, it's caused their red blood cell counts and those things to elevate so they can transfer oxygen more effectively, because they have lower oxygen stats. So is that going to cause fatigue? Of course it is. Of course it is. So your pulmonary function, your respiratory function, whether you have an obstructive condition or restrictive condition, let's just say you have a lot of weight and it is difficult for you to get enough oxygen to go up and down the stairs, that most certainly can contribute to fatigue as well. So a pulmonary function test, checking out your lung function, always a great thing, a test to do to check on things as well there. So, okay, let me see if they've got one more slide up here. Okay, so we went over, again, this is, we're right on time there. Went over several different causes of fatigue. Next week, we're going to go over chronic fatigue syndrome, also hormone imbalances that can contribute to fatigue. I mean, look at that. Your metabolism is predicated, of course, on your thyroid. It will affect your metabolism, how you heal and repair, and your energy levels. But your sex hormones most certainly will have an impact on your fatigue level, on your metabolism. But then also look at post-viral consequences. We know that multiple viruses are implicated in causing fatigue. So we're going to talk about that, about Epstein-Barr, cytomegalovirus. There's a herpes zoster. There's several of those. Some of your herpes viruses are related to that too. So we're going to talk about that in the literature, and then also about chronic fatigue syndrome as well. So like and subscribe to our page. We've got information coming out, of course, every week. Actually, I think next week I'm going to be gone, but the following week after that as well, we'll have our next one. And don't hesitate to give our office a call. We can help you out with anything. Try to find yourself one thing to do today to get yourself healthier than you were the day before. And it is, I wouldn't say that's easy for everybody, but if you break it down like that a little bit, you can find something to make a good decision for yourself. I try to do that with every patient here. Okay, what's one thing you can do tomorrow? You can't change, most people can't change their entire diet, right then and there. Sometimes it takes a day or 2 or 3 to plan for things, either to shop or whatever, but you can almost always find something you can do right away. Then find something also the next day and the next day and the next day. And almost always you're going to find some kind of good improvement. Sometimes it takes a little investigation to figure out what that might be, that improvement might be. Maybe that's a testing, like I said, a sleep test. Maybe that's looking at some kind of mold test, or maybe that's, addressing your foods and your ultra processed foods, those kind of things. Look at reading your labels, but almost always you're going to have some good improvement. So, and you'd be amazed what your body's going to be able to do down the road. So thank you for listening to us today. Like and subscribe to our page, Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed rest of your day.